There's unused drugs in skilled nursing facilities because of the amount of medications we have delivered. We get a 30-day supply for each resident for each medication they take. We can't send it back to the pharmacy. It's just such a waste. You look at all this medication and you know it's useful to somebody, and now we're making a difference in the lives of so many more people because we're providing them with the medications that they need that they otherwise wouldn't be able to get.
Good evening, everyone. My name is Kia Williams, and I'm a co-founder of SIRUM. I'm here today because of people like my aunt, who spent 30 years as a public school teacher in Philadelphia. Around her 60th birthday, my aunt had a stroke and was hospitalized. Upon release, my aunt realized that she couldn't afford the medications that she needed. She ended up in the hospital 2 additional times. I've heard this story from family and friends my entire life. This is why I co-founded SIRUM. Because I know that this experience with my family is not unique. This is Brenda and her family, and Brenda has a heart condition, and she was just hospitalized and released. And the doctors say it is not a matter of if, but when Brenda is hospitalized again, if she cannot gain access to the medicines that she needs to stay healthy. Before SIRUM, Dean was forced to take unused medications and actually ship them off to places like Fargo, North Dakota for medical waste incineration. And what happens with that medicine? It doesn't just disappear. It ends up in our air that we're breathing, and it ends up in the water that we drink. Dean was destroying nearly $10,000 of medicine every year. And there are 50,000 facilities like Dean's across the United States. In fact, there's $5 billion of unused medicine that goes to waste every year, while at the same time 50 million working adults report skipping prescription drugs due to cost. That's nearly 1 in 4 working age adults in the United States today. SIRUM is a technology nonprofit that connects the surplus with the need. What an idea, right? We're a peer-to-peer service that we've been likened by our donor network a little bit like a Match.com for unused medicine, for those of you who like online dating. So how does it work? We have a web application that allows a nurse like Dean to easily upload the extra medicine that she has and connects her directly with community clinics that serve low-income patients. It's easy for a nurse like Dean to scan in the medicines that she has, create a shipping manifest, print out shipping labels, and SIRUM handles all of the logistics from the nurse Dean directly to the community clinic that serves low-income patients. With a lean team of just 3 people full-time, we've distributed over 1 million pills to serve 20,000 people who would have otherwise gone without. That's the equivalent of 2 tons of medicine that would have ended up in a medical waste incinerator. 2 tons, for our Bay Area folks in the audience, it's approximately the weight of 1 Model S Tesla. But our vision is bigger. We want to see $5 billion of medicine that could otherwise be used, so that we want to see every pill going to a patient in need. Our vision is one that is national. The way that we do this is we grow state by state. We're currently in California and Colorado, and this growth is one that's sustainable. We take funds from people like you to basically spark this idea, to get it started in a new state. We then are able to charge a small fee from the clinics that we serve so that this program is financially sustainable, so that we don't require additional philanthropic dollars ongoing to make these programs continue in perpetuity. So our team is a group of Stanford alumni. I'm joined with co-founders George, who left a promising career in science. He has a PhD in biology from Stanford. Adam, who is our McKinsey consultant turned HBS dropout turned programmer. And myself, I have a background in public health from the Clinton Foundation, where I negotiated public-private partnerships for childhood obesity, along with organizations like Michelle Obama's Let's Move initiative. And we're actually growing. We have 2 new staff members as well, so that's very exciting for us. So how can you help today? $800 helps us train a new medicine donor, which will then go on to actually donate up to $10,000 of medicine every year. $5,000 helps us retrofit a pharmacy to receive donated medications for their patients. And $10,000 would actually pay for the shipping costs for the state of California's program for an entire year. And you know, the SIRUM team's been going to a lot of weddings this year. I don't know what it is, but we actually designed, we were tired of looking at other people's wedding registries and decided to create our own. So after all the presentations are over, we invite people to go to sirum.com, sirum.org/registry to look at other items that you might be interested in supporting. Thank you guys so much.